So with that in mind, I'm going to switch now to the Complete Denture program. Now, the RPD program is, of course, finished, available right now. The Complete Denture program is in progress and has not been completed, but we anticipate that this will be finished sometime in the next 3 months, I'm guessing. And this prototype version that I will show you, it gives you an idea. It is designed and in functionality exactly like the removable partial denture program. So let's just take a look at that. You come into this, you have a table of content. There's 3D and interactive programs, image gallery, animation, and video gallery. And here we've added some quizzes that I'll come back to in just a minute. But let's start with the 3D and interactive programs. At this point, there's only one of the 3D programs imported in here. There's going to be a series of other ones, but you'll get an idea. And we found this program to be a very valuable program to help the students understand. You can change the color of these casts, but there's a edentulous cast that are set up. If you click over here on this little wheel, then what comes out is your ability to make things appear and to disappear. So for whatever reason, if you wanted to just deal with the mandibular arch, you could do that. You can then click on and add a record base and wax rim. There's only one choice there. So it's just the way it is. Gives you a starting point. And then you can have an articulator. Whitmec Corporation was gracious enough to grant me permission to have one of their articulators scanned. And so you can put this into the articulator. You can show the students, they can open, and they can go into protrusive, and they can go into right lateral. And it, of course, is only one series of adjustments in here with kind of 15 and 30 degrees approximately. So it's not something that you can change, nor can you change the incisal guidance, but it gives a little bit of an idea as to how this would function. Now, I personally don't have the articulator on after I get into setting the teeth. So how would you teach the students to set teeth? And this is becoming more important now that we're moving more and more into the digital denture arrangement process. So you can click here on teeth, and then you have a choice of picking cross-arched balanced teeth for cross-arched balanced articulation, or you could pick lingualized teeth, which are, again, quite popular. Now, how does this work? So what you do is you'll click on a particular tooth, and you'll say, set the tooth. By setting it, that just means it's up somewhere close to where you want. You could then pick number 9 and do the same thing. And then you can go into these individual teeth, and let's then, and once you click on these, then you can actually take and move the tooth by the little arrows. See, I have the capability to move it backwards. I have the capability to move it down. I can go over here back to this tooth and move it down to what I want. You can rotate this to see, oh, I'm not even close to being where I want it in the record base. And then you can rotate the tooth around a little bit. You can look at it from the front and say, whoops, I didn't quite get that lined up where I want it. So let's move it down, and let's move it over to the midline. So what you can do is have the student learn how to do even multiple setups. We've never had the time in a laboratory to be able to teach a fully balanced cross-tooth, cross-arch balanced articulation, a lingualized occlusion, and a monoplane occlusion. So you could do that. And this program, when it's fully finished, there's still a couple features that we're adding to that. And that would be the ability to name and save a setup. So what I found very valuable is for me to do a setup. For instance, if you wanted a lingualized occlusion, okay, you sit down and you set it up on the right side, and then you can save that file. It could be emailed to the students, and then they would have to set up the teeth on the other side of the arch, and then email you back a file that you could evaluate to see if you like the arrangement that they've done. And that lends itself very well to online teaching. And even if you're not doing the digital denture process, which is not used by everybody, obviously, then you still have the capability to teach the arrangement of teeth in this particular program. And then there's this occlusal plane, which you can click on, and you can edit the occlusal plane. Let me push the edit button, and then you have the capability of changing this occlusal plane, you see, to whatever it is that you wanted to do in terms of heights and different things like that. So we'll take that off. And then up here, there's a this tooth gizmo selection that really just allows you then to move the teeth where you would want to put them. So this just gives you an idea of one of the 3D programs that's going to be in that Complete Denture program when it's all finished. And let's go now to the table of contents. And for instance, there's a section here, Complete Denture History and the Implications of Edentialism. So with the history of complete denture, again, just like the removable partial denture section, you have a chapter highlights, and then you go through a little review of dentistry and ancient civilizations, and then it takes you on a journey through all of the different types of ways dentures have been made. And I've been fortunate enough to have friends that had all kinds of interesting things. And the National Dental Museum in Baltimore was gracious enough to allow me to go into their collection down in the basement and look through and find pictures historically of all the different types of dentures. So there's wooden dentures, there's ivory dentures, porcelain dentures, and then complete dentures in the United States. So if you were interested in ivory dentures, then there's a whole series of pictures of these taking you on a journey through that process. Now I want to show one other thing. The edentulous anatomy, well, there's this section on the effects of complete tooth loss on the human body. This goes into all the physiologic and anatomic factors that happen when you lose teeth. And then there's this edentulous anatomy section where you can go in here, and it takes you on a journey through. It has all of the bones that are associated with an edentulous maxilla, and there's quizzes in here. So you can go to this particular quiz, and a student would have to identify, okay, what's the bones that comprise this? So let's say hopefully they could go over here and click on the proper one, and then it labels itself. And if they went to the occipital, that might be a little harder for them to figure out. So you'd have to do this. And then if there's any difficulty, you see you have the capability in all these quizzes, you can turn all the labels on, and turn them off, and then go back. And so you can either start out by learning these bones from the labels on, or doing it by the search process that I just showed you. And then if we go further, there's a section on edentulous bony landmarks with wonderful pictures of a severely resorbed skull with the mental foramen laying on top of the edentulous ridge. And then it goes through all of the landmarks that you would want somebody to recognize as part of the anatomy. And again, there's a quiz here that you can go into. And some of these are tough. I mean, these are tough. I can make mistakes all the time. So let's say if you wanted the student to figure out where is the buccal shelf located. So they'd highlight that. Then they have to go over here and say, must be somewhere in this area. And so they click on it, and okay, that shows them where the buccal shelf is, or they could turn all of the labels on. And this would show muscle attachments and everything, some of which is very challenging to do. But there's that present in there. And then there's the edentulous soft tissue landmarks that you would want somebody to recognize. So here, again, would be an edentulous maxilla, and the student would have to figure out, okay, where's the buccal frenum? And they'd have to go over and look at this picture and hopefully then click on it. And they could then have all of the things stylized, outlines of the different soft tissue landmarks that comprise this. So I think that's a good good introduction there. I want to show the oral pathology because Dr. Andrews and Boros did a beautiful job here of putting together something that I have not seen in a condensed form relating to the pathology that would be associated with a complete denture patient. So in here, you can see behavior-related complications, and then it goes through a series of specific things, starting off with candidiasis. And the way each one of these sections is laid out, there's a definition, there's some alternate names, and then there's all the clinical features that would be part of this, along with references as to where the information came from. After the clinical features, then there's a diagnosis, and that would be based on clinical pictures that are in here that would show a variety of different things. And then it goes into microscopic features, where you could see that, and then to treatment, and then to prognosis. So all of the major oral pathologic lesions that we might encounter, angular cheilitis, traumatic ulcer, epilus, fissuratum, inflammatory papillary hyperplasia, squamous cell carcinoma, all that you might see in a complete denture patient are present here in a nice abbreviated form, focused specifically on complete dentures. Now, in the interest of time, again, there's a material section, much like the one that was in removable partial dentures, but here it is again with a focus upon complete dentures instead of removable partial dentures. And then there's the clinical and laboratory procedures. And of course, you can see we've still got a few little things need to be corrected. The laboratory procedures is misspelled, but all those things will be taken care of in the final version. So here we take you on a journey from examination, diagnosis, and treatment planning to prognostic factors, all the way down through and including, just like before, relines, rebases, repairs, and then the section on immediate complete dentures and overdentures. So for instance, in the prognostic factors chapter, here's where you would find all the classifications that you might be interested in having the students know about. So there's anatomic factors, and that would take you on a journey through the palatal throat form, through Neal's lateral throat form, all the different classification systems, along with illustrations that demonstrate each one of these particular type of classification systems. And then there's behavioral psychologic factors, and this is kind of goes into all the history of classification systems. How did House and the Neal House classification of philosophic, indifferent, and all those ones, how did that come about historically? Well, it all began with Hippocrates, and this takes you on a journey through the history of how that came down eventually to become what we know today as the philosophic, exacting, hysterical, and indifferent, along with the references that track that journey through the process. So that's kind of a interesting thing. Now, a lot of people, of course, occlusion interests people with complete dentures, but again, there's everything here that you would be wanting to know. So with complete denture occlusion, let's take a journey into that a little bit, because here we have bilateral balance, lingualized, monoplane, and then there's a series of other occlusal philosophies. So if you were wanting to study the bilateral cross-tooth, crossed-arch, balanced articulation, there would be some pictures, a picture of a patient with that type of a complete set of complete dentures, along with the drawings that would show the representation, what it looked like in centric occlusion, and what it would look like in working and non-working side movements. And then there's actually some dentures here being set, the teeth being set in wax, that you can actually then see that particular process. So that's the bilateral balance. The lingualized occlusion, again, the same thing. showing some pictures of how that would look in a static relationship in centric occlusion, as well as in working and non-working side. And then there's some animations in here, just simplistic, showing a maxillary and mandibular molar and how they would be related to each other as you were going through a working side and then going into a non-working side movement. How would you actually achieve balance without the buccal cusp of the maxillary molar being in contact with the opposing? And then there's, of course, more views here looking at this setup from a lingual view. And this is actually a setup that I did in that 3D tooth arrangement program that you saw, and then recorded that, actually went through the movements and recorded that using a program called Camtasia. So I actually made these animations based on some tooth arrangements. So you could show a student how these different type of occlusal philosophies would work, including a monoplane type of occlusion, where you could go through that, and you could show again an animation. That, I guess that one's not functioning yet. Let's look at the animation and video gallery, and that'll go into the occlusion. Again, if we look at this, then this will show you all of the different occlusion animations that are there from different views. So let's take a look at lingualized from a facial view, and that would show the teeth moving toward us without the buccal tooth contact. And let's see, then there's let's see what else is in here. That's all the Hanau's quints and all the different things are in here, shown in detail how it would work. And then the let's see, I want to find one other thing here. Yeah, here we go. So this would show a monoplane occlusion where there was not contact of the molars in a protrusive movement. And how would we then achieve a balance, which could either be, of course, a ramp, or by tilting the teeth in such a way that they would be harmonious with the condylar guidance in order to create a balanced relationship. So you can find a lot of interesting things in this particular program, pretty much functioning like the removable partial denture program functions. Now there's the quizzes, and you saw 3 of those quizzes already, but there's also one on impression borders. And I wanted to see a place where you could find out what are all the anatomic structures that form the borders of a maxillary and mandibular complete denture impression, because that's what we would need to know if we're going to create actions by which a patient could help us to mold those, or we would be actively molding. So in here, you can see I can turn the labels on, and this shows all of the structures, muscles and structures that form the border or can affect the border of a complete denture impression in the maxilla. So this would make a great thing to be able to do. Like, for instance, you could go over here, let's say labial frenum, and then you can click on that, and you could then take this, you could print the screen and then just Photoshop out the name. And that's a great quiz question, which is exactly what I end up doing. So you could say, okay, here's the buccinator muscle, and where is that rascal located? What does that do? And then you could, again, without this one being present, you could then one at a time do these, because you can reset the quiz, go back and do buccinator muscle. Oops, I forgot to highlight that. And then come over here and then just Photoshop out the name. And there's a great question. Okay, what muscle forms that border, that portion of the border of a complete denture? And then how do you activate that muscle, or what do you do to have that muscle be active during the impression making procedure? So there's that present for maxillary impressions. And then the same thing for a mandibular impression. You have the same thing showing all the potential muscles and structures. great analytic process for quizzes and thinking about for you to do in your online teaching. And these, of course, can be, each one of these can be zoomed in and then moved around so you can show more detail where there's several features all together at the same particular location. So that really is the process of these two programs that I feel can be very effectively used in educating students by giving them assignments, having them do a quiz them on it. Then you go on to your online session, review the most pertinent things that you feel are of value and important to your particular class, and then turn around and have a examination at the end.